Hi guys, my name's Ashley Marshall. I'm a therapy and wellness clinical specialist with ASC Therapies and Wellness. And I wanted to talk to you today about some exercises that you can do to improve your breath support and control. And breath support specifically for speech. If you've been sick or had an injury or some type of surgery, our respiratory status and our overall breath support is one of the biggest things that can be impacted. So we can find ourselves getting short of breath and therefore not able to communicate what we want to say as easily as we would normally. So again, just want to go through some exercises for that today. So first thing to really think about when we're speaking and when we're breathing is our posture. So you really want to keep that upright posture, as I correct mine because it's a little terrible. But if you think about someone kind of pulling up by a string from the back of your neck, just kind of keeping that as much as you can to really kind of open up your lungs, kind of broaden your chest, and keep things as nice as tall as we can. And then, as everybody tells you, to get a really nice deep breath, you want to breathe in through your nose and out through your mouth. So we can just do that a few times, okay? So in through your nose and out through your mouth. Do that a few more times. In through your nose, out through your mouth. And one more. In through your nose and out through your mouth. Okay. That can have a really calming effect and just kind of help get you warmed up. So one thing, if you noticed, for a normal speech pattern, we inhale and then we take one kind of quick, big inhale, and then we can say multiple words and longer phrases and sentences on one breath, which is normal. So, but as our breath support is decreased, we're not going to be able to say as many words as we want to on that exhale. So a way to kind of practice this is to start small and really expand on that exhale. So what we can do is take a deep breath in and blow it out for about the same count. So you want to inhale for 3, exhale for 3. But then to kind of mimic that speech pattern, we're going to inhale for shorter amounts of time and exhale for longer. So I'll kind of count, hold up counting with the inhale and exhale. So we're going to start with 3 and 3. So inhale for 3, exhale for 3. And then we're going to inhale for 2, exhale for 4, and then inhale for 1, exhale for 5, okay? So you can do that with me. We're going to inhale for 3, exhale for 3. And relax. And then we're going to inhale for 2. Exhale for 4. And then inhale for 1, exhale for 5. Okay, and then relax. So you can do that over and over again. And then you can really increase the length of your exhale as you get better breath support and feel that you're able to do that longer. Another way to incorporate the length of speech into exercise is by actually verbally counting out loud and lengthening your exhale pattern that way. So for this next exercise, we're going to breathe in for that normal kind of count of 3 or whatever you feel comfortable with doing. And then we're going to progressively say longer utterances. I like to use counting because that's easy. But if you have any other different patterns of words, days of the week, your kids' names, anything you want to do from that. So we'll start with 1 and then go from 1 to 2 to 3. I'll show you how it works. So we're going to inhale 1 and relax. Inhale 1, 2, relax. 1, 2, 3. 1, 2, 3, 4. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. I know I counted to 10 on the last two there. I got distracted. So, but what that shows you, what you can do is to really lengthen the number of words, the phrase length that you're able to complete with every breath. So if you're starting at just 1 and 2, 1, 2, or 3, that's fine. Just kind of build it up as you get stronger breath support. And then the last breathing exercise I want to talk about for speech, it's called stacking. So this one is a little more difficult, at least in my opinion. So you're going to take a breath, and then you're going to take another breath, and you're going to take another breath, all without exhaling. So it feels a little weird on the system, but again, you can start small, start with shorter breaths and build it up that way. The goal is to really expand your total breath support capacity. So to expand and improve the amount of air that you're able to exhale in, so you have that reserve to exhale and speak. So it's hard to show, but I'll kind of explain it to you. So if you just breathe in real quickly, and then you hold, and then without breathing out, you take another breath, hold, and then another breath, hold, and then exhale. Okay, so it looks a little something like this. Again, it's hard to kind of see it. So when I breathe in, hold, 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 and exhale. So we'll show you that one more time. Breathe in. And exhale. Okay, so again, that's called stacking. So if you can only breathe in once, hold, and maybe a little bit more and hold that before you exhale, that's okay. Do that. Work to breathing in 3 consecutive breaths and then exhaling, because that's really what helps mimic the pattern for speech and breathing. Okay. And that's pretty much all I have for you today. So again, these are all exercises that you can do when you are having some trouble with your breath support for speech, ways to really kind of normalize that breathing pattern and build up your overall breath support capacity for speech. Okay, thanks so much.